Hello doctors, welcome to Metaclagic Revision Videos Pharmacology series. Today we are going to discuss anticholinergic drugs, so let's get started. Anticholinergics are the drugs that block and inhibit the activity of the neurotransmitter acetylcholine at both central and peripheral nervous system synapses. So we are going to discuss how anticholinergic drugs affect on nicotinic and muscarinic receptors, depending on their location in body. Firstly, we are going to discuss drugs affecting on nicotinic receptors. There are two types of nicotinic receptors. First one is neuronal nicotinic receptor and second one is muscular type of nicotinic receptor. Neuronal nicotinic type of receptors are present in all ganglions, so-called universal receptor of ganglion. Neuronal nicotinic receptors blockers, also called ganglion blockers. Ganglionic blockers blocks transmission of action potential from preganglionic neuron to postganglionic neuron by inhibiting the acetylcholine action on postganglionic neuron, thus decreasing the release of norepinephrine and eventually decreased blood pressure. Let's discuss some drugs. First one is mecamylamine. This drug is used by oral routes. It is used in mild to moderate hypertension as a second-line drug. Also used in Tourette syndrome. Also used adjunct to nicotine in smoking dependence. Next drug is trimethophan, which is used intravenously in hypertensive emergency. Next drugs are hexamethonium, tetrathiolammonium. The common side effect of this drugs are postural hypotension, so to patients advised to get up slowly from lying position. Next we are going to discuss muscular type of nicotinic receptor blockers. Also we can call muscle relaxants, as they relax muscles by inhibiting parasympathetic action. The drugs are atracurium and mivacurium. Now let's discuss the muscarinic receptor blockers, also called antimuscarinic drugs. Let's discuss from top to bottom in diagram. In central nervous system, dominant muscarinic receptor is M1. Anticholinergic drug blocking M1 receptor causes decrease in cognition. So the drug is also called truth serum, which are used in narcoanalysis. The drug is scopolamine, but the drug of choice in narcoanalysis is thiopentone. Next receptor is M3 muscarinic receptor, which present in pupil. Effects of antimuscarinic drugs on pupil are mydriasis, so the drugs can be used in ocular fundus examination. Also to prevent synechia formation in uveitis and corneal ulcers. Next effect is cycloplegia, so the drugs are used in refractive error tests in children, also to decrease pain in iridocyclitis. Drugs affecting on pupils are tropicamide, the shortest acting drug, atropine, most potent cycloplegic drug. Next drugs are cyclopentalate, homatropine. Now let's see how antimuscarinic drugs affects on M3 muscarinic receptor present in bronchi. Common effect of antimuscarinic drugs is bronchodilation, so thus drugs are used in lungs diseases like asthma, chronic obstructive pulmonary disease, etc. Drugs are classified into SAMA, short-acting muscarinic antagonists. IAMA, intermediate-acting muscarinic antagonists. LAMA, long-acting muscarinic antagonists. Short-acting muscarinic antagonists include ipratropium. It is short-acting drug, so dose is taken 4 times a day. Intermediate-acting muscarinic antagonists include oxytropium, aclidinium and glycopyrrolate. Doses are taken 2 times a day, and long-acting muscarinic antagonists includes unclidinum, revfinacin and tiotropium. As these drugs are long-acting, dose is 1 time in a day. This all drugs used by inhalational route, by using PMDI, pressurized metered dose inhaler. Ipratropium, the short-acting drug used in exacerbation in asthma and chronic obstructive pulmonary disease. Long-acting muscarinic antagonist tiotropium, the drug of choice in chronic obstructive pulmonary disease. Now let's discuss some side effects of this drugs. Dry mouth is a common side effect of this drugs, also abnormal taste, urine retention, so thus the drugs are contraindicated in benign prostatic hypoplasia. Next we are going to discuss anticholinergic effect of antimuscarinic drugs in gastrointestinal tract. Antimuscarinic drugs effects on M1 receptor present in gastrointestinal tract and thus reduce HCl secretion. As this drugs reduces the HCl secretion, this drugs are used in peptic ulcer diseases. The drugs are pirenzepine and telanzepine. The second effect of antimuscarinic drugs in gastrointestinal tract is that they reduces contractions in gastrointestinal tract, so-called antispasmodic effect. The drugs are dicyclamine, glycopyrrolate and scopolamine, the drug of choice in motion sickness. This drug is used as transdermal patch, which should be applied 4 to 5 hours before travel and in case of long journey, reapplied every 2 to 3 days. Now we are going to discuss anticholinergic effect on muscarinic receptor present in bladder. This antimuscarinic drugs reduces detrusor muscle contractions in bladder, so they can be used in overactive bladder or the bladder instability. The drugs acting on bladder are divided into non-selective and selective drugs. The non-selective drugs are fluvoxate, oxybutyrin, fesoterodine and trospium. And selective M3 blockers are the darafenicin, solifenacin and tolterodine. Now let's revise the action of anticholinergic drug action on different organs and systems here in the table. In central nervous system, effect is decreased cognition. In gastrointestinal tract, decreased secretion also decreased contractions. In glands, secretions decreased. In bronchi, bronchodilation. In bladder, decreased contractions. In circular muscles of iris, we can see mydriasis, and in heart alone there is positive effect that heart rate and contraction increased. So this was all about anticholinergic drugs. We tried to figure it out, its functions, action at different organs and systems level. I hope that makes sense. If you like the video, please do like, share and subscribe to my channel and stay tuned for upcoming videos. Thanks for watching video.